No up to the sun, yeah, let's come together. At home. They say you not there, we stand, if I there, we fall. If we not celebrate, we do it for you. Voila, you forget it. You from Lova Country, you from Maryland. Voila, you from Rewa Says. I'm a bad that way, oh, young people, I have a funny fine way. Tabila, I love Liberia, oh yeah, yeah. Free land on liberty, Liberia, oh yeah, yeah. Oh yeah, yeah. I love Liberia, oh yeah, yeah. They play for me and you, Liberia, oh yeah, yeah.
And this wonderful program, you're listening to EOBC 99.9. And the program you're listening to is called Open Conversation. Open Conversation is a 2-hour current affairs program that highlights the major happenings in the country. We talk about the development of your government, the Liberian People's Government. So tonight is an ecstatic time that we have to discuss plenty of issues, and with the presence of our wonderful and outstanding platform guest. My name is Washington Prince Tapper Jr. and we want to say welcome. Let's cross to our in-house panelist, Daniel. Good evening and welcome.
Good evening, Washington. Good evening, Titi. It's a fresh and brand week. Mm-hmm. We are here excited, and people in the audience are waiting for what we have to offer, so we can really offer the best.
Exactly. How have you been for the weekend, Chief?
Well, as I said a few weeks ago on the last week, that I have a responsibility. And that responsibility goes to the extent of ensuring that the president is re-elected. Mm-hmm. So my entire week and the weekends has been basically focused. So when I'm not here, I kind of spend my time in the district or in Bonnie, where I kind of, work with my people to ensure that the message, it's not just on the radio, it's physically implemented.
Exactly. Yeah. So let's now move on to our host, TT. Good evening.
Good evening, Washington. Good evening to you, Danielle. Thank God it's Monday and we have life. 7 days to election. 7 days to Tuesday. Next Tuesday, we go to the polls, run election, simple majority. One person wins, two persons are in the race, two candidates, in the race, and one candidate will emerge winner on a simple majority ballot. And so we're looking forward to that. And politicians are all over the place, endorsements all over the place. We'll talk about them. But this evening, we will speak with Health Minister Dr. Wilhelmina Jallah and Public Works Minister Ruth Collins. We want to know from those two ministers this evening what they have done since the inception of this government. It's important for us to know how far we are in terms of infrastructure, in terms of road, in terms of our health sector. Mm-hmm. And so we will be quizzing them this evening on Open Conversation.
Exactly. So those of you who are listening, the conversation seems to be very, very, very good tonight. You can afford to miss it. So let's start up with TC. What do we have on your template for the most trending issues tonight?
I know that we not, staying too long on the issues tonight, but we know that it's all about endorsements now for the two political parties in the race. And we know that the National Consortium of Teachers and University Lecturers has declared support for the second-term bid of His Excellency the President. And according to them, they're doing this because His Excellency has been able to sustain over 30,000 Liberians in universities, and they believe that is important. If a government comes to power and from the start, the president says that, you guys go to school free, and that happens until the end of his tenure. They believe that is sufficient reason why it should remain there, so that can be legislated. And they also talked about the WASP fees that were paid, continue to be paid by the government. Is something that is impressive to them, and they believe that they can also talk to the students And according to them, there are over 50,000 teachers across the country, lecturers, and they pledged their support to the re-election bid of His Excellency the President. We know over the weekend, President Weah got another big endorsement from the Muslim community. That was a very huge one. And so far, so good. We're hearing of different endorsements. I heard again today that I know in district number 17, those representative candidates who participated in the elections pledged. They came together. I think 9 of them came together and pledged their support.
Even District 3 today was in studio.
Okay. Yeah. Okay. Listen to Sumo.
Correct.
And even the guy from
the other district
from Grangida County, district number 3.
Correct.
So
2 good friends.
incidentally, 3 of them are representing district 3 in Montserrat and Grangida County. They all because he's from Moniba's party, right? And they all pledged their support, to the re-election bid. And so the president has been getting lots and lots of endorsements, and hopefully these endorsements will
amount to something better.
Translate into votes. And, he will have another, time again to serve the Liberian people. We also know that the opposition Unity Party, I think a few minutes ago, they were endorsed by the former finance minister Amara Kone. And so as far as we know now, it's ALCOP stand-up bearer and the people who support him endorsed the opposition Unity Party. And today we heard that Amara Kone also endorsed that party. But Amara Kone is no new person to...
I would have said the same thing.
I would have said the same thing as well.
The Unity Party. He served in the Unity Party. Yeah, he served in the Unity Party during Ellen time. We all know Amara Kone for budget shortfall. And so I hear the Unity Party folks saying he brings a lot of, a lot to the table. Well, actually, we know I like that. Because he won in Bapolu County. As the senator, he replaced the late Daniel Nathan, who didn't have an opportunity to contest because he died. He would have contested in the race. Nobody knows what would have happened. But Kone got it on a civil platter because Daniel Nathan died. So you should be thank you. And so he pledged his support to the opposition Unity Party, as far as we know. Those are the 2 endorsements now. But, it sends a signal. People always say that, if you're in opposition and you're better off, we should see that, because he was endorsed by Tiawon Gonglo, then ALCOP stand-up bearer. And I always like to say ALCOP stand-up bearer because ALCOP is
because it was not a unilateral decision.
No, it wasn't. The stand-up bearer went to the Unity Party, while the vice stand-up bearer went to the CDC.
Yeah, so it was a divided stuff.
ALCOP.
Yes.
And then we saw endorsement today now from Amara Kone, Senator-elect Amara Kone, to the Unity Party. So as far as we know, unless you guys know something else that I don't know.
Well, no, just like you said it, you put it right. These are the things that happened today. All of these different endorsements, both from the Unity Party and the Coalition for Democratic Change. That's just what's been happening. These endorsements, there are some with meat, some are just spill milk, others are empty shell. And like we always said, the most important thing is the people of Liberia are cognizant of who the true leaders are. You can come in all of your elegance, they know who they want. So take for example, there's another thing that was training Titi. So someone got honored.
Of course, a request from His Excellency to attend service.
Exactly.
Right, and the Unity Party folks are
so jittery.
Yes,
very much jittery.
Thank you for that reminder. We need to talk about that a little bit.
And only to see later on today, earlier on today, he had to go. He went to the Unity Party headquarters to endorse Black Eye. You know, these are, they say old wine in new bottle. Nothing added, nothing subtracted. Nothing. I told somebody something, right? In all honesty, if Senator-elect Terry McGill had run in Bapulu County, Amara Kone is history.
But I thought you kind of got it on the,
So pardon. It's history because the charismatic and development-oriented nature of McGill. McGill is the first Liberian politician, just like Snow, despite all of the challenges this government went through, that went to Margibi County. It was able to win elections there. Margibi is almost like most of the country. It's a mixture of different tribal people there.
Yeah.
But so imagine, if an Amara Collins endorsement of Unity Party is the same old people.
But that's why he said some of them have meat and some of them are just the shell.
Let me define with you the greatest thing that's ever happened for Amara Collins and Jeremiah Cole was the eye of the coalition for democratic change. Had the coalition not supported Cole, Edith would have flocked him. Had Senator-elect McGill had not run or ran in Margibi County,
he wouldn't have been senator.
all that pound for him making a zero. Because the people would have taken McGill for him.
Exactly.
So you see, so we're not baffled over the fact that they're not endorsing the president. What are they bringing to the table? This man has given you more than you're going to give him now. In fact, he's leading and welding a generation of young Liberians. This is the administration that has brought more young people from very ordinary background with no social political alignments to the table. Yet they do extraordinary stuff. So basically that was just today.
Yeah, but the thing about it is, obviously, you will see the Unity Party folks, clowning all over the place.
I know.
And they know within themselves. I always say this, that the only person you can lie to is yourself. The fact of the matter is, since NEC announced campaign open, Unity Party cannot come up and say, we can make it. So they just have to put up that bravery and act. Because if you go into elections where almost all of the people who participated in the elections are, throwing their weight behind the ruling party, it should send a signal.
Exactly.
What is wrong with us? Because we're in the opposition. Why are people not endorsing
They should be supporting us.
Imagine them getting the numbers they got. Right. Okay. But what about the people? Because CDC flocked to you the first round, right? And then we're going to the run-ups. And you see all of these massive endorsements going towards the president. What do you think is going to happen? But again, when you're in a competition, you just have to tell yourself, no, we can.
You got to build up your tenacity.
And part of the joy. In fact, 98% of the happiness that has been expressed in the public with these endorsements, especially Amara Kone and the rest of the people, is financially inoculated. The reason is very simple. If you listen to Costa today, the revelations he made, the documentations he showed,
that was sad.
And the desperateness of trying to raise monies for personal pockets from both sides, Jacob McCauley on the other hand, former Vice President Bob on the other hand, pushing him against the wall and milking these people. It tells you that the party in totality
needs to be rescued,
whose cabinet has already been reviewed as the same 06 and 7 that has already milked this country's coffers in the last 12 years, are coming back now that needs serious rescuing. Couldn't spend all of his time in the house as one of the most corrupt lawmakers. Safuli monies,
of course,
and his own personal aggrandizement.
The only thing Kun has been able to do is to build his school and then use public fund to
enrich his hospital,
to run that hospital. Sorry.
So you see, so at the end of the day, if an Amara Kone is coming, apparently he's going to be raising money to people washes and finance some other smaller campaign activities with the hope and beacon of saying, okay, I want this percentage for your win.
Exactly.
It's not about Liberian people anymore. It is about their personal gain against the people of Liberia, because these are the people who were there before. If we had a new look, you see, the argument is unique. if we had a new batch of Liberians who had never tested the political savviness of our country yesterday, in the last 12 years, are the ones that are second to the president, there's so much to be worried about. But these are 99% of the people that are in the Union Party today that are conforming to this philosophy are people who were in the last 12 years, who milked and polished our national resources. Billions of dollars going to individual pockets.
With all of the international support.
Exactly.
Yeah.
So imagine the stand. I like to always say this. Imagine the standard bearer, who according to them is an integrity icon, is the most experienced, made 2.5 million every year, which is $36 million in 12 years, but is yet to show you $1 and say so he's lift up nose.
And monies have been raised for him on several occasions.
You saw in the communication where he said to Costa, his dependable nephew, endowed with that blessing, that other 5,000. Please go get it. Just give it to Maureen, because Jacob Akoli is after I will not see it.
Jake has been a very
peanuts.
human
They
being for
proposed
the country.
They proposed how you call him a minister of state who financially terrorized the office of this the proposed president.
Jake has always played. He has always played.
It just show you nepotistic. You know, today it just show you the acuteness in the nepotistic nature of this party that want to lead this country. If you are crying on your quote-unquote nephew, but you've made him your minister of state,
of course,
it means that all the milk and honeys that are going to spill around this society goes directly into your pockets.
But Dana, that's what we said. The thing about the rescue is the irony of their practicality, the practical actions that we are seeing, the attitude, the character of the people that have grouped themselves to call this a rescue team. If you can be fighting, if you can be afraid of Jake, when it comes to financial, entrusting him financially, then what becomes of the country's coffers? Look, you understand? What becomes of it? Let me tell you, people like Jacob, our colleague, and the rest of the other folks surrounding former Vice President Joe Barker will be the major player.
Look at presidential spokesman. A man who sat here and took 2 salaries. He was sitting here when his friend's wife was the medical administrator at JFK, and he was on salary at JFK. These are people. We went to Firestone. A same meeting sat under Manasari's administration for the retirees that this government pushed. He lied to the people. Somebody who was in that meeting called on his platform. You listen to it, and the desperation. This allows them to remember the mistakes of yesterday.
I know.
You had 2 salaries. You milked.
I call them
BRBC, JFK, and you tell Liberians that you are a new result.
But I want to say, are you serious? That's the irony of rescue. That's the irony. Like you said, the desperation of these people today have allowed them to live in oblivion.
Well, the re-election in the country, in the West. Let me say this on records. Daniel Nooks Thomas. When these desperate, or rascals win election in this country, I will go as a farmer. I will not work for them in any day. You know why?
The way you allowed to work for them.
Let me tell you why. Immense integrity is in his works, in his conviction.
Of course.
If Patrick, who president we are at the time of senator, will come for overseas and pick things for him with his name embroidered, will sit behind this favorite board and try to do Adobe audition of the president's voice to mock him while you're taking 2 salaries, double dipping.
Yeah.
We go to counties and talk trash about this president. Are these the people who supposed to? I can never work with these people. It's not possible. I want to go make fun and support my family. The good thing is I'm a Liberian and I'm entitled.
And you're entitled
to that sovereignty of my nation.
Yes.
But these people, they are dangerous. They should not be accepted. They should be rejected.
Desperate.
They're not serious. Desperate hospitals.
Well, I think we should bring our guests in. Let's take a short break. because if you didn't listen to Costa, you just need to go and listen to
Yeah,
it.
serious.
It's just so it's
And it's
just
shameful,
mind
Titi.
blowing. Yeah, it's embarrassing.
Yeah.
It's shameful for a
So they say
former
you say big
statesman.
money,
Because it's sad. All I can say is that it's sad.
That Papa's opinion,
I don't know
Papa's
about
opinion,
that. I don't know about that, but it's sad. If you say you're going to rescue us and you need to be rescued, then where are we going?
We're not giving our country the poor. It's not possible.
But I like the fact that the Liberian people, are wise people, and that is why you see all of them endorsing the president's re-election bid, because with all of these revelations and what is coming from the Unity Party angle, you can imagine what is going to happen if these people come back to power. And so the Liberian people were very, very smart enough to say, no, we can allow this to happen. We're already on a road that we don't need to reverse, because these people are already broke. They're hustling. They're coming back after 12 years with all of the monies that came into this country. How many billions dollar investment? I'm forgetting.
If you compare all, it's almost 12 billion. Guess what? But it had 8 billion reckless resource contract. An international audit group was called for by Madam Salif, came to this country. I just told you, tomorrow, Romano, I'm going to read the documents here. The audit reports came up. It was so sour and bad that guess what? The cabinet ministers, they met. And they put the reports out, we're looking at disgrace for $8 billion resources contract went into pockets of individuals. Take for example El Nito, $150 million. They even put a shovel in the ground. People want people too. But you know the secret, the beauty of these endorsements, Titi, against the last elections. These endorsements are a clear attestation of the Liberian people unwavering results to re-elect the president, contrary to their scarecrow tactics of rigging elections. When we are winning them now, guess what? That crap that H. family were talking about, the country be country with a desperate cabinet general who has personal issue against the president. When president we are winning in the second round, and they come up to say that the election was rigged, the Liberian people run after them.
The sad thing about
it's
it
is joke.
I was listening to the radio, and every party needs to, you need to step up your game, because their own partisans,
they got game?
They're not even, they're not campaigning anymore. Either they don't have money to do that, and you see the CDC, citizens are all in the communities, trying to encourage people to vote for the president. A very older man called on one of their shows. I was listening on Saturday, and he says, I'm calling you because he heard another person call from VOA. The person says, I support Unity Party, but I don't see anybody campaigning in the community. And this is sad, because Dara Zilon and the rest of them, they're just sitting down. Then the other guy, the older man called from Broadville. He said, I'm calling to tell you guys that CDC got our people all in the community, convincing people I'm a Unity Party person, but I don't see you people campaigning. Tomorrow, if CDC win the election and you people come up, we will join CDC to tell you people, to tell you.
You heard it?
Yes, he said it.
Oh, really, right?
Yes, of course.
That's what I just said.
He said, we will join CDC to tell you don't do nothing.
Of course.
But I was like, wow. But maybe,
Thank God somebody called and said what I said.
They do.
I didn't listen to that program, but I just tell you.
They just open the lines on Spoon and say, just say what is on your mind. More than 5 persons from different places call and say, we're not campaigning, nobody in the community, and this and that, and blah, blah, blah. I was like, okay, good. But I think we need to take a break because we have 2 ministers who are going to appear this evening, and we need to give them enough time to talk.
From the east to the west, north to the south, let's come together. They say you're not there, we stand, if I there, we fight. If we not celebrate, we do it for you. Voila, you forget that. You from Lower Country, you from Maryland. Voila, you from Rewa Sessu. I'm a bastard, we own your people, I walk on the fine way. Nabila, I love Liberia, oh yeah yeah. Free land on liberty, Liberia, oh yeah yeah. I love Liberia, oh yeah yeah. Play for me and you.
this phone, but I chill with my goons. Kept it on the low, but we fall for the boom. True son of the sun, I'm a prince in my own. Never gonna lie, me, I love LIB. Even though it's far, when we show 'em we can fix it. It's not a prophecy, I know that we can rise again. Holding my hand, I holding your own. United, we stand, divided, we fall. So that's what I say when I come with ball. When I chillin' on that side, and I get no bro. I got L to the O to the V and the E. If we fighting together, we can conquer this team. From the east to the west, then waving the flag from the north to the side. Yeah, that's joining the team. You go where you pella, you love my crown. Who kill it? Who got shown up?
I love Liberia. Ooh, yeah, yeah. Free land on liberty, Liberia. Ooh, yeah, yeah. Ooh, yeah, yeah. I love Liberia. Ooh, yeah, yeah. They play for me and you, Liberia. Ooh, yeah, yeah. Ooh, yeah, yeah.
Mama was born, yeah. Papa was born, yeah. They hold us together, the honey boy, yeah. Nabalike na koya bake na papa bobo. Nabalike na koya bake na papa bobo. Nabali pole pole na papa bobo. Nabali pole pole na papa bobo. La biro waka poma o. La biro waka ma o. Bangada anwa waka ma o. Anwa waka ma o. Anwa
From
waka
the east to the west, north to the south, yeah, let's come together as one. They say united we stand, divided we fall. If we not celebrate, we do it for yeah. Walla, you forget that. You from Lower County, you from Maryland. Walla, you from Rewa Sessu. I'm a bad dad, we own young people. I walk on the fine way. La villa, I love Liberia. Ooh, yeah, yeah. Free land on liberty, Liberia. Ooh, yeah, yeah. Ooh, yeah, yeah. I love Liberia. Ooh, yeah, yeah. They play for me and you, Liberia. Ooh, yeah, yeah. Ooh, yeah, yeah. I love Liberia. Ooh, yeah, yeah. Free land on liberty, Liberia. Ooh, yeah, yeah. Ooh, yeah, yeah. I love Liberia. Ooh, yeah, yeah. They play for me and you, Liberia. Ooh, yeah, yeah. Ooh, yeah, yeah.
Master Square on the mix.
This is Open Conversation on ELBC Radio. I know our listeners will open the lines for you to make your input, but this evening, I'm sorry, when we're taking calls generally, then we'll talk about maybe what's trending if you don't forget about that. But I know you will be consumed by all of what the ministers of Public Works and Health will be talking here tonight, and you will want to be a part of that. So we apologize for that this evening.
Are we good? Okay,
so let's get straight into it because we don't have much time. We got two ministers here. We want them to say a lot of things to us tonight. Minister Coca Collins, good evening. Welcome to Open Conversation. Minister
Collins, you can.
Minister Jallah, good evening, and welcome to Open Conversation.
That's good.
Good evening.
They were fire in the morning.
Good evening, and thank you so much for the invite. We are happy to be here. I think this is one of our first time appearing here on your program.
Open Conversation.
Yeah, we actually happy to be here, and I believe the message should be clear and to the Liberian people. And let me say hello to our Liberian people that are following this video, that are following this station right now. I want to say hi.
Me too. I want to say good evening to all our listeners out there. We know you have a lot of questions, and we do our best to answer to the best of our ability.
So God is going to help you today.
Yeah.
So that's good. But we'd like to welcome you again. And the conversation is open,
Exactly.
so we're going to keep it open this evening. So let's do this. Please give us, an update and this question is for both of you. Looking back 6 years, when this government assumed the leadership of this country, what was the status of the health and public works sectors? So anybody can start.
Let's start with you, Minister Collins.
Oh, I was looking at Dr. Jallah because she started.
Because you can be welfare before you. Yeah. You can't be sick and go, right?
She started long, and so she's having more to talk
Okay,
about.
Minister Jallah. Yeah, let's start with you.
All right. Good evening. Like we said earlier in the morning, you can look at things at some of the problems were long-term problems. For example, drugs not being in the facility. This is an old age problem that everyone is trying to solve. And we met that problem on board, or distribution of drugs, or stock out of drugs. We met that. We met not a good ambulance system, or we met some of the equipments were not in the facilities. We met some facilities that were broken down, or we met some facilities with all light. We met some facilities with all water. So and we met the healthcare workers or salary low.
Okay.
So we didn't create that problem. We met the salary low, and so these are some we met poor housing facilities. They were all renting, or the rotational schedule were non-existing, or some of the policies were not there. So we met some of these things on board, and we only try to correct them and add new stuff to where we left off, because government is continuous. So you can't blame them, but you have to come now and add things onto what was not there before.
Which one was perfect that you didn't have to add to?
I can't remember anything that was perfect that you didn't need to do anything on.
Okay, let's hear from.
So again, let me say thank you for us, for the Ministry of Public Works, and when we went there, we went in later, and we didn't get there from the beginning. But when we got there, what we saw there was the Ministry of Public Works never had its own equipment, and for the infrastructure or for engineering institution like the Ministry of Public Works, we thought that machines, and without machines, it mean that we're going to be functionless. And then when we got there, we saw that most of those minor work that will be done by the Ministry of Public Works, most of them were being contracted. So these are things we met there, and then we saw that most of the staffers from the mobile divisions were just passing up and down because they had not much to do. There was no equipment, and in fact, their workshop was almost like a cinema, because the guy they have on television and everybody would be kind of surrounded. But when we got there, things kind of changed around because people were involved. People started doing work, and the technicians from the Ministry of Public Works, they are people that are more professional, but because they didn't have anything to do, they have to fund themselves, and they were just doing nothing. And these are things that we met there, and we thought that we will have make it better. And today I can say that it has become better. We got some fleet of equipment that we are using, and some of the repair on the lateral roads have been done by the Ministry of Public Works. The workshop is now functioning. We have the operators and the mechanics. They are all working in line. And the ministry is busy now because, in the absence of nothing to be done, you find that people will be kind of just hanging
Very
around.
idle.
Yes.
At least the cinema is closed now.
Exactly.
Okay, let's come back to you, Madam Health Minister. In the health sector, many Liberians, who could afford, opted to travel abroad, maybe the sub-region, Ghana. Where are we today? What didn't we have then? And you have been able to procure?
Well, today we have a lot of specialists, where before we didn't have a lot of specialists. Now we have a lot of specialists, including pathologists, oncologists,
Who is an oncologist?
or people who deal with cancer,
Oh,
people
wow.
who have cancer. So we have like 4 oncologists now in the country.
Good.
One medical, 2 GYN, and 1 pediatrics. So we have these people here. All we have to do is continue to build, because once you train these people and as they come back into the country, you have to have the proper equipment for them to work with. Right now, at least in the country, the pathologists are able to do DNA, they are able to do specimens. So at least we can make the diagnosis here, even if we don't have all of the things to make you better, but at least we can say this is what's wrong. And even if you go out, you will follow what we have or started treating you for. But it's better to stay here because people here. When you go to Ghana, I mean, most people that go out of the country, especially to Ghana and other countries, they come back with bad experience. So we continue to build the system so that they can remain here. As since a lot of equipment were old and updated, we got to put new equipment in there, and these things cost millions of dollars. So you have to put them in little by little. You can put everything in at the one time. You use the entire health budget just to put these things there.
So you have procured,
Yeah,
new
we've been
equipment?
procuring little by little,
Okay.
or things that are needed. We like right now, one of the hospitals are doing laparoscopic
What is
surgery
that?
where they use cameras to look into the body.
Okay.
You can find them. It's being done at Jackson FDO, which was not being done before. So we're hoping that people take advantage
That's good.
of that type of surgery where they don't have to open, they can just use the camera to do the work. So you can find that here in Liberia. I'm sure a lot of people don't even know that's going on at Jackson FDO now. We have one of the modern or ICU equipped at JFK right now, so you can go there, and if you're in critical condition, you can have that critical care treatment there. So things are getting better, but everything cannot be put in there because you have to solicit those things. And now that we're ready to procure some, we're hoping that we get the opportunity to continue so that we can put these things.
So you didn't meet an ICU at JFK?
No, there was not an ICU there. We're still even training critical care nurses. So we're trying to build the population of nurses because they are the main one. We need to build anesthesia because they are the one that are supposed to be there. So we're trying to start an anesthesia program. We have like 1 anesthesiologist in country. You need more. In order to run those big type of specialty, you need more trained manpower in the country.
You have one in country.
Yes, and we have one out of the country training. We have one in country, and we got to continue training because.
So in terms of training locally, internationally, before I come to the Public Works Minister, you send some of your people abroad to specialize in areas of pressing needs. If yes, if you've done that, tell us about some of those areas.
Well, we have somebody doing cardiothoracic surgery. They out there training. They finish the first portion. They will be coming back after they finish the second program. That will bring a new light because now once we can get the proper equipment, the proper setup, then people don't have to go out of the country to do basic thing like or any kind of minor heart surgery. And eventually, as support come into the country, we might be able to go even further. So the more specialists you have that can do big things. Now we have neuro surgeons here. We have one. The second one just graduated from China. He's coming to join that one. So we have 2. We have to build on these specialists because before specialization, everyone was just stopping at general practitioner. Now today we are getting more and more specialists that will be coming back into the country with the ENT. They will be coming back, ear, nose, and throat doctor. They will be coming back. We have other orthopedic surgery for bones coming to join, and many other surgeons that are.
These are Liberians you send out to
These
get
are
trained?
Liberians that were here in Liberia. They are gone. We have people for infectious disease. We have trauma people. All of them, some in South Africa and around the country. They will be coming back to join the specialists that we have here right now in the country. We can do eye training. or a specialty for eye. We have family medicine. We have internal medicine, surgery, pediatrics, or obstetric and gynecology here in the country. And so we'll be adding. You need to have all of these specialties, right? We're even in the process of looking for a physicist and a radiology oncologist to be able to run. Once we get the cancer center set up, we need them to run it. We have trained dialysis nurses. We open a dialysis unit, so we have trained dialysis nurses. We have somebody that out there to learn the specialty to be able to come back. Right now, we have foreign doctor taking care of it, but we will be training our own specialists to come in.
So the dialysis center you're talking about was opened under this government?
Yes.
Okay. So let's come to you, Madam Public Works Minister. Your mandate dealing with roads and other infrastructure, including monitoring and enforcement. Where are we?
So we have done a lot. And to begin with, we are currently working in all of the counties. And we have our own trained engineers, and they are assigned to most of the projects. We have the project in Lofa, the one that starts from Banga to Salaye. We have our engineer, even in training engineers are already on the projects. So like we said, we have projects everywhere, including Monrovia. So we have project ongoing in River G. We have project ongoing in River Says, Sano, and Obon, and everywhere, including Nimba. I didn't want to talk more about Nimba. Nimba take like 60% of our road projects.
Wow.
Yeah, so there are a lot more that we are doing. And like your question, we having both females and males out in the field working, and that's something we're proud of. And I mean, from the way we see things going, I think more females now being motivated to join us in the field. Like when we started, we were kind of just two females that graduated at the time when we were graduating from the Stella Marie. But today, we find that most of the engineers now coming out, they are prepared females, that are ready to face it. And one cool information I would have like to add on our conversation as we continue is that the fact that over decades, the engineering society of Liberia, the ALCC, the Chamber of Architects, every one of them have been running beyond an act that will enable them to form part of a system, and they have been denied forever. I want to say a big thank you to His Excellency Dr. George Manawia, and I also want to say thank you to the chair on Public Works in the Senate and his team. Today, in few weeks or months to come, we'll be bragging about having our own act, the Engineering Society,
Okay.
the ALCC. So that's a good news for us. I just thought to announce it because that's something that we have been
Yearning
running behind
forever.
forever. And the president think that we ourselves need to be functioning because they will also help us.
Okay.
So we having the RRA role.
Yeah, I wanted to ask you, but before we go to the RRA road, right? So you've just started work now because we go into the dry season, right? Because I hear you talk about, you've got your projects are ongoing now in all of the counties. But the ELWA road, especially, I'm going to start off with, for us here, ELWA, LRA intersection here, just close to us, right here.
Yes, today.
Yes, it's so bumpy.
Yeah, today I was. I said this morning that between now and the Wednesday, we will do, which is day after tomorrow, we'll be doing some work there. Today, myself, when I saw it, yesterday I actually drove there and saw it from church. I felt so bad. Today again, when I saw the fact that garbage had been gathered at the center, I was like, Jesus, it's getting bad. So we are going to be working there, and we'll start mobilizing our equipment from tomorrow, and then we'll try to make it okay, as we waiting. Because what we halted for was because we had to redesign that intersection. So what we had before from the previous engineer or the consultant was just something straight, and we thought that that was so beautiful. That area was so beautiful. We just have a straight lane, so we got something or roundabout that will be placed there, one of the first in the country, with something like a monument in the center. So we kind of hire our own Liberian or engineer or architects, and they came up with something very very beautiful. So like we were waiting for the dry season to get started rightfully, because that's a critical thing, and we had to wait for it to get dry. So we'll be doing that in this dry season, and it'll be one of the finest roundabout. I don't know where we'll have any like that right now in the
Is
country.
it coming to start as of Wednesday, or you're just trying to kind of level that place for us to use it again? Are there plans for you to start that? This
So the actual plan was for us to do it between now to December to have it completed with.
okay.
So, but what we about to start is just to have it perfectly pliable, and to make it in good form and shape.
Okay.
So between now to December, we're supposed to get started with the actual pavement, but then the rain have stopped, and then the contractor have brought in his materials and
Okay.
everything. Yeah.
So tell us about the RI area. What are the plans before we come back to Minister Jallah?
So for the RIA road, we are on course. I know there have been a lot of crashes along the way. People describe the process, the project, so many different ways. But today, we are seriously advancing with the pavement, and the contractor is so much prepared to do it, to have every section on the road paved. So they started pavement already from here, few meters away from the intersection, and they started the paving. They are now somewhere around
Menekuma?
no, not Menekuma.
No, yeah, I mean.
Menitama. Yeah, Menitama junction there. That's somewhere around there where the pavement is right now, and they had to continue just I think a few days. It rained in, so they had to prepare some area again to get it started. So we will get probably next week. Yeah, next week we'll the other side from the airport side. We will start to prepare it for pavement as well. So we'll be working from both fronts like we've been doing. So we also looking at the design of the bridge, because there will be a new bridge
Where?
on the along the RI highway. The Two River Bridge. There's a river there who can already cross. There's a small bridge there right now, but the new one will be very much modern and very beautiful. So we are kind of concluding the design process with the consultant. Like they will have a Japanese consultant that we are working along with. So we have been going back and forth with our engineers, to have the design completed with. So we also will have the project comes along with street lighting, on both sides of the road. But we were thinking whether to have it in the middle. So we have been going back and forth to see which one would best suit the project. So we're gonna be coming up with something very.
What is the estimated time for that road to be completed?
So the entire project is for 5 years.
Okay.
So the implementation is for 3 years, including the time of the bridge. And then we'll have 2 years for defects liability, meaning if for some reason the project could not be finished within the 3 years, probably if they can run into the fall, just on allowing, and also to monitor if it is finished within the 3 years, then to monitor what are some areas still intact, what are some areas need to be repaired.
Okay.
So that's what the additional 2 years.
How many years have we gone now?
We gone 1 year already.
Oh, okay. Let's
Yeah.
take our more time. Okay, let's come back to you, Dad. Please tell us, doctors to patient in Liberia, what's the ratio?
Oh, big number. Probably what? I think 5,000 or something big. I don't know the exact number, but right now with the 5.2 million people, the ratio is very, very high.
But is it better than before?
Well, if we look at the number of doctors from before to now, then maybe we added 100 more to the number that was there,
Okay.
or over the 6 years, or it was probably 100 and something. Now we are 300 and something. So maybe 150, 200 got added there. But what we're doing is in a country like Liberia, you can add up the doctors, but you got to add up the number of nurse specialists. Because what we've been focusing on was doctors, training doctors, but then their counterparts that will help them manage hasn't been trained. So our focus in this administration, we were continuing to train the doctors, but we're looking at our nurses and other healthcare workers, because we want to make sure if there's an oncology, then there should be an oncology nurse. If there's a OB, we have to have OB nurse. So this is the way how we've been balancing, and then we just getting ready to start a new nurse practitioner program. So other people will be able to take on that ratio. It will not be only doctor to patient ratio. It will be all the people that are practitioner to patient ratio, because if you have nurse practitioner, you have physician assistant that are more trained, then they can take on some of that patient ratio to reduce.
Okay. So referral hospitals, where is Liberia today in accessing critical health care?
Right now, there are two major referral hospitals, the one in Jackson F. Joe and JFK. So those are still the two major, and I forgot 14 military. 14 military have risen up to be one of the referral hospitals here now. So we got Jackson F. Joe, 14 military, and JFK. We got other radio hospital in River says the Bapalu Hospital. We are building it up because they just opened, so we have to get the required number of specialists that we are assigning there, to be able to reach it up to tertiary level.
Okay.
Or some of the other hospitals, like we're working now to open the New Redemption. Once that hospital is open, it will be mostly women and children. So we'll start with women and children, and then we'll be able to add the other specialists in phase 2. So right now we're working on trying to set up as many referral hospitals, but you always have to have a balance, because we need to change the system where we focus on primary health care as our key focus while we build the higher level hospital. Because if you don't get people before they get sick, prevention and screening, all those basic things that we need to catch at an early level, then you have more sick people.
Okay.
So we are really working right now on strengthening our primary healthcare level. We have gotten funding to be able to rehabilitate almost all our primary healthcare system, put light or solar in them, put water and other things. Then we'll begin to supply them with at least the basic equipment, or be able to take somebody's blood pressure, which we have supplied almost over 5,000 nurses. We have given them these equipment. All they have to do is just bring it to work. So we are encouraging them as we provide it.
Are they bringing them to work?
Well, we have to go back and check, because since we provided the 4,000, we have to ask their supervisors, are they bringing it to work and using it? So you got to be able to take somebody's blood pressure, their sugar, their urine, just to catch some of the early things that making people more sicker to travel. So we want to really focus on community health and primary health care.
You want to, or you are focusing
right now? We already doing. We have a strong community health program. We have over 5,000 community health workers in the 15 counties, working at the community level, making sure to monitor malnutrition, making sure to treat children with malaria, diarrhea diseases. So they're already there working.
Okay.
So 5,000, and we have the supervisors. We have about 500 and something supervisor, 530 something supervisor, looking at that level while we now step up. So if you have a good community health program, then you need to make sure that the centers that they will be sending the people to ready. So that's the one we are working on right now to make sure those centers are ready. Then we continue to build our tertiary, but we want to make sure that you get everybody can get that primary health, preventive, and all of those educations at that level. I think Liberia would be much better.
Makes a lot of sense.
Where,
Yeah.
where they will be eating, exercise more. Make sure you go for a checkup.
Yep.
We're right now doing it with the women. We're talking about breast cancer. We just had breast cancer in October. We want to make sure women that are aware that they need to go for a mammogram or go for breast examination, because that's one of the killer of the women.
Is it only in Montserrat or
It's all around. We got
when
we
it
got
comes to
people-
breast cancer? Then?
we're talking
People-
to all around, all of our counties. The doctors there are aware to examine the women and to make sure if you find anything, report it. We're also looking at cervical cancer, which is the number one killer of women here in Liberia.
What is that?
Is where you have the HPV virus, which is a human papilloma virus affecting the cervix and giving you cancer as you get older. So what we started to do was to vaccinate, because it can be prevented. So
Okay.
we are currently vaccinating our 9-year-old, and then in early next year we'll be raising the bar to 14 and 15-year-old. So from 9 to 15, because that's the stage where
They can
the
be
virus can attack, and so to prevent it,
Oh, okay.
then we can look at screening, making sure that women are more aware. We've been doing it, but just to keep aware, knowing the signs and symptoms, knowing when to go for your pap smear, we got to keep those things going.
Yeah.
Same thing with the men, will be telling them about prostate cancer and those things. So we'll increase the awareness, because those are the basic things that are catching people right now, that are causing deaths and other things.
Before we come to the Minister of Public Works, how many hospitals have you built as a government, and where do you intend to build additional to meet the growing health needs of our people?
Okay, so during the president regime, we got Bradia, we got the 14 military, we got or the hospital in Bapalu,
Emirates.
Hospital, which
USS.
is one of the ones that we're going to really be looking at. So actually, 4 hospitals have been built, and we will now, we build hospital or in those places, or improve on the hospital. Grand Jide Hospital is on the way. It's in construction right now. It will soon be the Redemption Hospital is on the way. We had to cancel the contract, redo it, and stuff like that. The hospital in Riverside is done.
Correct.
Or we were looking at the hospital in Mangibi or Rennie
The CH
Rennie
Rennie.
Hospital,
Yeah.
but we had to construct recondition the health center to make it a comprehensive, so it can be doing surgery. But while we build hospitals, we'll probably add additional hospital or refurbish the hospitals that we already have. Some hard to reach areas, we have to start constructing other clinic or healthcare center, because there are people behind rivers. You got to get in boats to get to some
Yeah,
of them.
right.
So we need to look at all of those people, at least to have a health post or a clinic or a comprehensive health center into all of these areas. So we're reviewing the health plan again to look at what are the areas that have high population that needs a facility.
Great. So, Madam Public Works Minister, if I don't ask this question, then my people in the Southeast are going to what is she doing on that radio? So, let's talk about access to the Southeast, to Southeast Liberia and Lofa Medikoma Highway. Give us the timeline and how are you proceeding as funding is being secured?
Okay, so we all felt it during this term of elections. We have to go through a lot of stress to travel through, but up to date, we have gone so far. The government of Liberia started the first project, which was the 39 kilometer from Ganta to Sakipia, because going to the southeast you have to pass through
Lima.
Lima.
Yep.
So when
True.
we first launched our project in Ganta, we knew exactly that we were heading to the southeast. It's just a matter of time. So when the government came in and started the first 39 kilometer, and the World Bank through the president, his strong negotiation with our partners, they did the next kilometer, which was the 61 kilometer that took us from Sakipi to Tapeta, and that project is ongoing now. Most of the bridges and clearings are ongoing. So we have just signed another 40 kilometer that took us from Tapeta to Tota, and we were kind of waiting for the dry season to fully get started, and we had some administrative issue of which we are going back and forth with the bank, and before the dry season actually commence, the contractor will be fully prepared to get started. And then we were very much happy from the World Bank again that the fundings are available for the 85 kilometer that will take us all the way to Zredu.
From where to where? From where?
From Totan to Zredu.
Okay.
Yeah, from
Yes.
Totan to Zredu, which is
Okay.
like 85 kilometers. And what is happening now is we have to do the studies, the design, and these are things that we are planning now to get doing. And then after that, we have to do the procurement process for the civil work contract. So again, then we go to the back and start from Fishtown, River G, because right now we are doing the 20 kilometer from Fishtown to Kilipo, and
Okay.
then finance is being secured now up to John Davis. So meaning we only have a gap of 48.5 kilometer between River G and Fishtown that is not attended to yet. So from all the way to Fishtown to John Davis Town, the fundings are available, and there are a lot of studies ongoing right now. So we are kind of very much excited so that 2024 we can get started with most of the Southeast project. And also from Barclayville to Clonin to Sastan, works are expected to get started in 2024. And like that project is being financed through the ECOWAS Bank, through the
African
SM
okay.
Bank of India,
Wow.
and that bank, the both process is working parallelly, where the civil work contractor is being vector for, meaning the AfriSM Bank have already put out the proposal for the contractor. At the same time, the design for the civil works, the studies have already gone up to 65% completion. So we don't have to wait completely to get finished with the design and the feasibility studies, before we kind of launch the proposal. So both are working together. So what will happen is that when the Indian, the Indian Bank, when they get finished with the proposal, they will have to get those factor contractor and send it to the Ministry of Public Works, to do the final one. So maybe they will get 5 or 6, and we can send it back to us to get the best one from all of it. So we are working closely with them, and that project is one of the project that will soon get started, in 2024. So there are a lot more on the way for the southeast. Like we know, probably it's just a matter of time. That's why we keep encouraging them to keep being focused, and there are a lot more for them. And also we have advanced the conversation with the African Development Bank for the first phase of the work that will be leading carrying us to Sino. The first phase is from Grand Bassa to Sesto. So that is about 57 kilometers, and we have advanced strongly advanced the conversation with the African Development Bank, and we are very much hopeful to get it started anytime soon. So there are a lot of plans and pipeline project on the way. So we go to Lofa. We talk about Lofa, from Banka um, to Salaye is already ongoing. Like the pavement are already reaching Lofa. So we having a conference or a meeting again with, because that road is being financed by the Arab banks. So we're supposed to have another meeting with them to see, because they were in country some part of last year, and we were very much clear, and they told us that a certain percent, like it will reach to 65 to 70%, they will come for us to start the plan again for the next field, because from Saturday now we're supposed to be going to Konya, from Konya to Vonjoma, and the high work. So also the African Development Bank have provided fundings for the studies for the entire corridor. So while we will be doing the studies will give us the clear picture of how much we will need to have the entire corridor paved. It will also
You mean
tell
straight up to
Minikoma.
Minikoma,
Yes.
yeah.
So we also going to be doing the same thing too from Grand Bassett all the way to Greenville. So all these studies will be available, and we'll know how much or what it takes to have those and those area paved. So we are pushing for it so that we'll have those data in our hand. So in terms of seeing any gap or financing, then we're going to be able to say, okay, this one can fit on this one, then we'll try to put it there. And also our western area, we already started the Medina Ravensport, but we have to start now from Ravensport coming towards Medina. So the second phase will be from Ravensport going into Medina, and we try to launch the procurement process in a way as we're looking for financier to help us to have that completed with. So we receive a lot of proposal, and we are trying to see which one of them we can use to have the road paved. So we also launching. We already have a contractor tool from the Totota going to Bonota area there. We are still in conversation with them. We have not concluded yet with the other pavement, and the Samoan people, I know they'll be excited to be hearing this.
Yeah, right.
These planes are on the way.
Yeah.
And also from Simple Bridge going to not Simple Bridge but from
Freeport.
so that project is already on Monrovia side.
Yeah, Monrovia.
I want to talk about Swain Road
Okay.
from Burrowville going through Compass. So we're doing some major maintenance, but we are pushing harder to have those area paved.
Okay.
Like one time I was actually there, and then somebody said that's one of the oldest road in the country, and why it is not paved. So we also trying to open up and put out the proposal if we get pre-finance arrangement from some of our partners, and also the Ministry of Public Works through the National Road Fund. We're also going to be looking into that. Even if it is 5 kilometers, we'll be kind of be doing it gradually as we are waiting, contractor that will be a partner that will be able to fund us to continue with it. Same with Bird to Bipolar, these are plans, to launch it so that we can be able to have additional partners that will be interested in doing it. So all the plans are on the way, and we are very hopeful that, when we complete with them, everywhere will be busy. Every part of the country will be busy. At the same time, we already started doing some city street pavement. We completed the Barkerville city street pavement with a chip seal, and we were just to do another pavement in Greenville, but then we had to slow down because of the rain scene with Rosas County, Sesto. So there are a lot of things that we're doing, and we are very hopeful to continue.
Yeah, you seem to be doing a lot. Really, really lot. But I still want to know, before I ask my next question, I was talking about Freeport to Broadville, that stretch. Is this starting this dry season?
So for the same team that did the Japan Freeway. They are the one that will be doing the second, or let's say third phase of the work, because they did the first lane and the second lane, and then they actually have been pushing that they want to connect their road. So from Freeport coming towards Johnson Street, there they will be doing that stretch of road. They have been coming back and forth from Japan doing their studies. So the government of Liberia already working closely with them, because we don't want to have two different designs.
Yeah.
So the level of the road should be the same.
Consistency.
Yeah. But that is being contracted already to a contractor who is trying to continue with the maintenance, and then the both project when the marriage and see, what we can use as a design. Probably maybe we'll do some amendment again on the current contract, because that's something that we really want to consider doing, because we know that that corridor is actually one of the major corridor that, I think that is the most critical area that we know about, because the axle load there is how
traffic is also
passing through. So we are looking at that as well. Yeah.
Bureaucracy surrounding, getting the projects off the ground as it relates to funding to jumpstart. What can you tell us about that?
Yes. So for the GOL, what happened first is that we have to make a plan, and then we go to the legislature to a budget defense. And after that, our proposed plan, we gather them and send it to the PPCC for no objection. So when we receive them, then we publish those projects, and then we try to gradually find the contractor to have them done. That for which we have control over. But for the bank, sometimes the bank, you have to do everything. You have to send it to them for no objections. They have their own timelines, and sometimes, the delay come from us because somebody somewhere is not in the office to have something signed. So, but all these things we try to minimize the timeline, and the bank have already seen the reason that we need roads. Like our road network, when we did the studies in 2018, our road network that we need to concentrate on now is around 13,000 kilometers of which.
Did you say 13 or 30?
13.
13.
Okay.
Yeah, it's not that it is all of the road, but the studies that we have only for our major highways is around 13,000 kilometers, of which we met 745 paved, and then up to date we have 1,131 kilometers.
Minus the 700 or combined?
Inclusive.
Okay.
Combined is what? 1,000 what?
1,131 kilometers.
So you to the deduction.
So
I'm still not getting her because you're talking under 1,000 what?
1,131 kilometers.
1,131. Okay.
And the numbers will keep adding, because we say continuing with the pavement.
Okay.
So with that, we have more to do. And I just want to be clear that the challenge still lies ahead of us, even though we try to improve it. But we still have a lot of challenge in so many ways where, like you said, the bureaucracy surrounding having things to be done. We have a lot of plan, and then probably the resources is not enough to cover everything at once, because we working with both the GOL, meaning the Ministry of Finance, and also the National Road Funds, and there are more to be done. Yeah.
Okay, let's come back to Dr. Jallah, because this one, universal health care to everyone, should be void of politics. And for the past week, I hear you talk about, training for more doctors and healthcare workers in Liberia. But we have noticed these few days and for the past week, what are your doctors, what are your nurses up to? Because we're hearing, especially from Bong, and then our River G correspondent again was talking about that this morning, where your nurses are involved into politics and they're turning patients away.
Well, we heard we have been made aware of that, or it could be many reasons. One of the reasons maybe they did not understand fully the harmonization process. I think that one of the reasons why people are dissatisfied, they think their money or were cut, or their salary will decrease. But for us in health, or the especially the clinical people, maybe the non-clinical people are the one that maybe, or causing someone the attitude to be raised. But for the clinical people, we explain to them a couple of times, and we are still explaining to them that in Liberia before there were two salaries. You had government of Liberia and you had incentive, and that happened over the last 12 years before we got into government. But as the government changed, most of the partners drew their support to the country. So the government decided that we will combine your salary. So whatever it is that you are getting as your incentive and whatever it is that you are getting as a GOL, we're going to make it one salary. The GOL were in Liberian dollars. So when you convert that Liberian dollar to US dollar, you will get one salary. And most people, or some people, were only on one salary. In fact, some people were only on GOL, or some people were only on incentive. So they took everything, they made it one salary. Now, when that one salary came, it came with a cost, because now if you were making 200 plus 100, that's 300. That 300 is subject to, that's your gross salary. It's subject to income tax, it's subject to Social Security, and it's subject to insurance. So definitely your money will come down. But most people, like we said, they do not know how to access the pay slip. And the pay slip for every one of us is online. So if you can access your pay slip, then you will see that your money was not actually cut, but you will see that your money comes down. The more money you make, the more taxes you are going to pay.
Correct.
And so that's one grievances that everybody had. But remember, I told you in the beginning that most of the nurses, the PAs, and the other cartridge or healthcare worker, their salary were already low. So what this government tried to do is to try to raise the salary, because we all realize that nurses were not making a lot of money, and
doctors,
PAs, the doctors were a little bit up, but the rest of the healthcare workers were down. So the government, in some counties, they raised the money. What they tried to do was look at people. For example, two nurses, one making 1,000, one making 400. So how do we balance this equation up? So some people came down. For example, they brought you down and they carried that other person up to make it even. But I think that clarity did not hit everybody for them to properly understand. So that made people unhappy. So I think part of the grievances is that their salary, as much as the government is trying to raise it, and it has been an old age problem, but it still, resonate or poorly with a lot of people. And I think that's one of the major reasons why people showing dissatisfaction. And maybe they're also showing dissatisfaction because maybe the drugs are not there. But the government needs 22 million to provide drugs for everyone. And on the free policy, it makes it very difficult for them, because if you spend 22 million on only the drugs, you will really have, when you look at your overall health budget, you are going to have a shortage. So we as a sector and as a people, we have to find creative ways to change that. We cannot continue the free policy across. In some counties, for example, Lofa, where we started drug revolving fund, there's drugs in the facility. So we need to run that across, or making sure that the communities are involved, provide the seed funds, and then to have the drugs and the equipment they have. So I think that most of the dissatisfaction, but we try to de-escalate some of that factor.
I really get all of what you're saying, Madam Minister, but harmonization has been more than a year or two now.
Still on their mind.
It's on their mind, but what about the Nightingale Creed? why did they wait for now to express that to the patients who are going, to the clinic or to the hospital?
That's making us, that is baffling for us also, because we've been talking to them. We have gone there. Keep politics. You are the Red Cross for the country. If you engage in politics and turn patient away, it could cause a loss of life. And we have had meetings with each county health officer. We've been in the counties talking to them, but keep the politics out of the facility. But apparently, I don't know what's going on with them that making them raising it. It's not happening in every county, but in specific
it's happening
county,
in Bone County,
right?
And we're told that the head of the hospital there is even on record.
CB
Dumba.
Yep.
She's on record. When these people do these kind of things, do they get punished for that? Because it's about the lives of the ordinary people.
Well, the county health officer have taken some action. Keep talking. We didn't fire people. We didn't go to the extent of firing people. We called that particular or medical director and explained to her the situation and the crisis that she would be causing. And this is what we're going to do. Even tomorrow, we'll be in Bone County based on what just happened again in the facility. At this particular point, we cannot fire them. We have to come to some kind of mediation. We've been talking to them. If you fire all of the healthcare workers who are involved, who's going to be there to take care of the patients? So we got to keep talking to them to make sure that they stop that kind of activities within the facility. And for now, this is what we can do. Because if we say we're going, we'll move the medical director. Next, we'll move all the people. Who's going to be left? So we have to keep dialoguing with them, telling them it's not right. And this is what we have been doing.
It's serious, because if you don't take charge, we're hearing that it's even in River G County where you have, CDC nurses on the side, Unity Party nurses on the side. If you're coming to the hospital and you support CDC, you have special people who are going to. How can doctors and nurses be involved in such a thing?
And are they also aware that there are other competent and qualified individuals that are willing or that are ready to take off from where they start? Because if this,
it's just sad.
Because if this continues, I learned that, like you said, the Bone County thing. That's why she said they're going there.
Yeah.
Because Prince Moyi met with all of these people and they sensitized these people. That was the result of the CB Doma, the director there. He met with them and politically sensitized them against the administration. People who from Bone County will tell you that. So if these things are happening in the county, in as much as the Ministry of Health, like the minister said, they're doing their best to try to dialogue with them. But if this continues, I'm very sure that there are some decisions that LOE is going to take. Yep.
One of the things that we're looking at, hopefully we can keep dialoguing with them at least until the runoff is over.
I agree with you. Totally agree with you.
Because we went to almost every
Totally agree with you.
all counties. We went River Sets, we went Nimba. We talked to the people in Grand Chita. We got people in Yofa talking. But Nimba, Bong, I don't know why they're so politically charged.
Serious.
We try to de-escalate.
If you have a senior, a senior lawmaker who allegedly is involved with that, then you can understand why exactly that is escalating. It's about the patients, because you hear another patient saying, "I came to the hospital, I've been turned down." It's sad. Where does that person have to go? And you say, we're not treating anybody here. How do you do that?
Right. We can't understand why they will want to do that to their own people.
How?
You took an oath to be able to care for everyone. Why are you taking sides? This election will go, and then you still have...
It's just seasonal.
Exactly.
So sometimes we hear about the new health law. I want to know from you, are there critical concerns in that law that we need to address in this modern era?
Well, the new health law covers a lot, and it looked like we may have to pull it and add all of these things, or for the future elections.
Exactly.
We might have to put these new policies in that law so that each one of the healthcare workers can
Sign up.
read it and sign as they come into the health sector. Maybe we didn't think about it that they were going to be this way, so it's not in the law. But we're hoping that the law passed. One of the things that been holding it up was the idea of abortion, but people did not understand what that situation was, or maybe we need to take time for a few minutes just to explain. There's a 1972 law that was passed in that year, in that time and era. That law have not changed from 1972
Till now.
till now. That particular law says, one, that the first thing they said was abortion is illegal. Then they added that, or if two doctors agree in the case of rape and other abnormalities, then the abortion can happen. And then the third thing that was way down, which I think maybe the lawyers did not read, or whoever was making that law did not read. They gave the women authorities to carry out their own abortion.
Wow.
It's in the law.
Oh, wow.
But there are two things there.
But that's the
So that means it will be away now from the doctor's concern.
right. So this is in that law. So we looked at that law, and in the new public health law, we say all of the things that they put there that are good, and they say up to 24 weeks. That's the time they give. We look
Those, critical assets.
so
under the Ministry of Public Works, we actually supposed to take care of all infrastructure, and we have started making plans to visit some of these buildings. But it have to be looked at thoroughly. There's some of these buildings have lived in life like the Hotel Africa. I have not been there, but I heard that there was some partner that came in country wanted to rehabilitate it. So until a serious attention be drawn to that, I mean, we cannot say okay, we're going to this. So maybe probably that request can come from, because most of the buildings I know it was owned privately by people.
Oh wow.
Yeah, so I'm just saying it the way we saying it, because I know this building. Like I was surprised to know that Ministry of Finance is privately owned by somebody. So until we are asked to look in those directions, we can look there. But we are always prepared as a institution that will work with all of the institutions that are trying to do their own work, like Dr. Jallah. We have the infrastructure unit that we're working closely with them. We do the design along with them, and then they go out with the team, and then we only monitor what they're doing. So that goes across. So most of the institutions, see, like agriculture ministry, some people doing roles, but we work along with them to feed these contractors, and then we monitor the work along the way. But right now, for the infrastructure aspect, like the market building is wholly being done by Liz. Yeah, Liz is doing most of the work, but we just work closely with most of the institutions that will be doing it. Before, all of the responsibility were on the Ministry of Public Works, but now, after this war, most of the different institutions have taken it to themselves, but we only work along with them to guide the process in doing it.
So the final question for me is for two of you. How much money do you need to get started on a full scale?
For the Ministry of Public Works, if we can have a billion data, then we will get started. Then we will really know that we really ready now to get work started in Liberia.
What is Liberia's budget?
She's just telling you what she needs to get. $1 billion.
But that's what she needs.
Wow.
Yeah, of course.
Because we're having a huge road challenge in our
We
country.
get a lot of challenge.
She talked about what 13,000 plus kilometers.
What is
Yeah,
given,
and we've just covered 1,000 plus.
what is given, I mean, we just managed to get that, but that's not our need.
Yeah.
You said needs, so that's why I'm saying that if we ask her, we'll need more than a million.
Yeah, Madam Minister, follow up on that before we get to. You are informed about road construction and engineering and all of that. Are there possibilities wherein all of our roads are pliable in 100 days?
It's not possible. It's never possible. You may have even up to 500 machines. It's not possible to have all of our roads
Exactly.
in 100 days. It's not possible. Yeah.
China, listen, they're for engineering. Turn over.
So let's hear you, Madam Minister.
Well, I will be going right along with her. We need that same amount of money.
$2 billion now.
Come on.
Make sure that all of our facilities are up to par with all of the equipments and all of the things that we need, medication, or to keep people from going out of the country. So that's the kind of money you would need. But right now, based on the budget of the country and based on the fact that most of the health budget goes to paying salary, we have to.
But you get a lot of international support, don't you?
The international support go to particular. You see, right now they run vertical programs. So, for example, HIV, TB, malaria, one thing.
Special funding.
So it's not taking care of, some of the things that you need to take care of. So, like for example, now we're working with the World Bank. The World Bank can say, okay, what do you all need? We need facilities to be or rehabilitated, and they will, do a survey. Also, the FARA program, they will do it, and then we all work together to do it. But there's still a lot more to be done. So in one budget that they gave us, it will do some, but it will not do all. So in order to do all, you need lump sum of that kind of money. Then you just fix everything, and then you start from there.
Yep, correct.
So before I can hand it over to you, I just
Okay.
want to clarify this one, and that's a serious concern to the Ministry of Public Works. This new financial year, of the country, where it starts from December or January to
To the summer,
December,
yeah.
it's not too good for the Ministry of Public Works in the sense that before the budget passes, or it's already in the rainy season, and not much should be done. So I mean, we said that before. I just want to try to see what I can emphasize on it, that probably maybe some adjustment can be done. Ministry of Public Works, can be front loaded, so that we can have some time to do our work
Yeah.
in the dry
Especially the
season.
seasonal challenges that you will have.
Yes,
Definitely, yeah.
yes.
We experience this year, and I just try to look at it. It's not really good for us because when the money is prepared, it's already
In the rainy
in the
season.
rainy season.
And you can't work over
You
dry
can't
season.
do you can't do much, with it. So I just want to highlight that.
Okay.
All right, so let's go to the lines and take calls. Like if you're listening, we have two distinguished our studio guests tonight: the Minister of Health,
30 seconds.
Dr. Wilhelmina Jallah, and the Minister of Public Works, Ruth College. The numbers are 0880.
30 seconds, one question, and you can be specific.
Yeah, you gotta live in the confines of the
Please.
time. 30 seconds. 0880-514-096 are the numbers. 0880-514-096. Let's check out our lines. I hope our lines are good tonight.
Maybe no question.
No, there are a lot of people listening. There are a lot of people listening to me, sir. Good evening. Good evening.
Yeah, caller, you live. Good evening. Be live.
evening.
Loud, please.
Go ahead, Robert.
Robert, you're low.
Robert, you are not coming clear, sir.
Hello, you get me?
Okay, Robert, go ahead.
Yeah, I want to ask the Minister of Public Works, it's not public works right now, it lies in the hands of the young engineers, like students that are getting carabaris and doing engineering. What are those mechanisms you got in place when it comes to students having an internship, and we are not really practicing or clinical knowledge, we only going to do theory but not practical. So what are those mechanisms you can use as a result for those young engineers that are coming out? Thank you very much.
Okay,
Hello?
thank you. Good evening. Welcome. What's your name and where you call from?
My name is Kwekwe Kima. I'm speaking to you from the Swandaka district.
Go ahead, quickly. Hello, quickly.
We would like to know as to how do we get to the hospital in Bapolu? What are we are looking for as well. You take the road between Broadway, Swandaka district to Bapolu, or you take it from Bomi to Bapolu, because we are praying that you pass the road from Broadview to Bapolu. This is a shortcut to Swandaka district. Can you explain that? Okay. Thank you very much.
Thank you. Let's get this caller. Good evening. Good evening. Let's take this person. Good evening. Hello.
Look, so I'm sorry, we can't use this line. It's really terrible. Call us on 0770 1926 96, and you'll be live on Open Conversation. We can use this line. It's very terrible. 0770 192696, and you'll be live on the program. Zero 0770. This line you're calling, we can use it because it's very bad. 0770 1926 96, and you'll be live on the program. Don't call the Lone Star number. We're not going to take that. It's very bad tonight. Or maybe
we could also use the alternative 088190 2195, the Lone Star.
Hello?
Yes.
Hello?
Hello.
You're live. Please go ahead. You got 30 seconds.
Okay. I'm Rachel Lamy calling on the show number 2. We have to be precise. I want to say thanks to the minister for her. I listened to her. And for my suggestion, for those of the nurses that want to prioritize the life of our people with their politics, those that are willing to work, let them replace the people. Because you can't be at the hospital and telling people you're not going to work because you feel that maybe you don't want to support the government. Because for the nurses, they are not even supposed to get involved with politics because you told us to protect life. So if you will be there telling people you're not going to treat them because you feel that maybe the party in power, you don't want to work with them. Those that are standing by and competent to work, let them get in a position to work.
Thank you. Thank you, ma'am. Hello? Hello?
Yeah.
Please go ahead. You got 30 seconds.
Yeah, hello.
You live,
Hello?
Hello?
You're live.
Yeah.
Go ahead, please.
And I'm from more calling from Banga to be precise.
Let's hear you, ma'am.
I want to think the serious case, but we can't tell we suffering. If you don't mind the government hospital, I think into the making party headquarters. When you go there, when you see the shade, they can take out to you. They will ask you, you're going to make 2 or you for number 1. As soon as you say you're going to make 2, they will say, but then no medicine here. If I say the peace, I don't know yet. We suffering, I think, because of our aid.
Thank you, ma'am. Hello? Please move away from my radio. Hello?
Yeah, good evening.
Yeah, let's hear you. 30 seconds, sir.
Okay, take your money and charity because I'll do calling for Pop County.
Okay, let's hear you.
Yes. Okay, let me appreciate the minister of health. Yeah, I want to know there is any law that said that any administrator that in the office or in the health minister that is starting health worker to vote the government because the government are under the salary. So what is the penalty that I want to know?
Okay. She's listening. She will tell you the penalty. Hello?
Hello?
Yes, sir.
Good evening, Chico and Washington together with Daniel.
Good evening.
Okay, this is Daniel S. Ray calling from Innocent to be specific, district number 2. I had to your studio get the 2 good ministers of our time. Today, on the issue of hospital, the government is trying. On the issue of the rules, government is also trying. But we want them to do more. We want for government to do more. Because our president, his passion is rural. And so we want it to do our southeast road. And the road that is going to this good hospital that is just being built at in Papolo. Myself, on our road, the road is very bad. But our good road there, I mean, people won't be able to go to that hospital. So I'm appealing to them, appealing to Ruth for police, so that you will prioritize that identical road to beg them.
Thank you, sir. Hello?
Yeah, hello?
That you come my hello, you sleeping?
I
calling you out. I'm begging you, please. Hello? What is that? Hey man, this sleeping, you sleep? No. You calling your friend and won't call on the radio. Hello?
The voice is admirable.
What is that? 07. Somebody who really won't do it. Hello?
Hello, how you doing?
I'm good.
Okay, this is Benjamin Kai.
Let's hear you, sir.
Yeah, I want to thank you for the explanation concerning the medical side. Yeah, something you were trying to say about the abortion or thing, but I was on my radio, so I didn't really get that own self-abortion. I don't know whether you hear. Yeah.
What are you doing with abortion? You can you woman?
I'm not a woman.
I'm just kidding. Don't worry. She will explain. Sorry, she will explain.
Okay.
Hello. 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 Somebody's just on this line. They don't want to go.
You're cutting off.
I think so. Hello? Wow. Let me try this and see.
Hello.
Sarah.
How are you?
No, that's not.
I'm sorry.
No, it's terrible.
Hello?
Yeah. Hello.
Yeah.
I'm Paul Simwe calling from the Boston Marshall Highway.
Okay, Paul. Let's hear you.
Yeah. I'm very thankful to this video get concerning about the road project that they're talking about concerning about the hospital and so they admire them very well. They really show that our president is doing well for us. That how best our country can be a country that will be an example for other countries.
Okay. Thank you.
So, yeah.
Hello?
Yeah, how you doing, sir?
Good.
I'm calling from Bangor today.
Let's hear you, sir.
Okay. Yeah, my question is directly to the Prime Minister. I think the president appointed you guys to really help. And I can recall that when you were appointed, there were a lot of complaints against you. People don't want you to serve the position. But I feel that sometimes people that have not been very concerned for your end to really help the president. Now the health workers are using your weakness to come directly to the president to make me feel bad.
What is your point, sir?
My fear is that but the president ever time and people have been complaining to all.
What?
Now the people are using their to help us.
You support what the people are doing? You think what they're doing is good if they took oath to treat people? So why?
Because when I went there, I saw the pictures on their phone. Only because they think that they are cut their salary. So that they have this, and you just get to know about it or it happened before. Right? Well, use your profit to talk to the president and start doing our being.
Okay, thank you. Thank you, yeah?
Okay.
Next caller. So you want him to at least answer intervals?
No,
Would you all
let's just
conclude
take
calls?
the calls. Yeah, let's take at least 4 more calls and we'll come back to them.
Okay.
Hello?
Hello?
Yeah?
Yeah, I just want to ask the minister up there because what I know, the nurses are also like a soldier. You're not supposed to partake in politics. Do you think that the nurses are important? They're not lying for the patient?
You won't answer that question, eh? All right, should we answer?
She will answer you.
Thank you. We'll take 3 more calls and then we come back to our guests in studio to respond to your calls. Yeah, this person keeps calling this.
The line's back.
Hello? Hello?
Hello?
Yes, you're live. Go ahead.
Yeah, you see, my name is Emmett. I'm calling from Peaceville. I got the Minister. Madam Minister,
this morning you said that you are, I mean, you are seeking funding to pave the road from Barclay Road to Sassan. I wonder how possible it is to pave the road from Barclay Road to Sassan when the road from Libo to Barclay is not paved, and the one from Greenville to Barclay is not paved. Where would the equipment pass to pave the roads from Barclay to Sassan?
Okay, sure. Respond to that, yeah? Hello.
Yeah, good evening.
Good evening.
Yeah, okay, my name is Lord Methode, and I call you from Kakata, from my resident in Canada.
Okay.
Yeah, my question, first of all, I want to explore the two ministers that in studio for the level of work that is been doing this government to help the government with the development of this country. But my question goes to the public works minister. What plans does she have or the government have to connect Loru to Tapeta City, because Loru is not accessible to Tapeta and it's closer to Tapeta.
Okay. What plans does she have? She will answer that. Yeah, to connect Loru to Tapeta. Okay, we'll leave it at that, and let's come back to you, ministers. Anybody can start with the questions you've received.
Okay, so let me get started. The first quarter talk about an internship program, and that's something that is currently ongoing at the Ministry of Public Works. We receive communications from several universities, from the TU, from Stella Marie, from Stella Marie, from the UL, and then we create a space for internship. So we have an active program. The only thing that I think we need to do is to try to improve on it, where we will try to look for extra funding that we actually amend them by giving them some allowance, because most of the time when they come, they go strictly in the field to practice. So that program is actually active at the Ministry of Public Works. So the second color talk about the Popolo bombing road, which one will pay first. If the fundings are available, we're going to be doing both pavement, because both ways lead to the hospital. And it's two different locations, so people from the Swan Market area, they will also like to go to the hospital. People from Birmingham will also want to go to the hospital. So we are trying our best to see whether both pavement can go together. So there was another caller who called and were concerned about the southeast and the western corridor. And the western is the bombing Wapolu Kiban corridor. And we are very much keen in having most of the problems solved. I think I listed a few of the progress that we have made up to date, or where we are in terms of road connectivity. So we are just very much hopeful that we can be able to commence this work. So the last quarter that I called, and he was concerned how can a pavement be done in Barclayville, and that brought in mind the pavement of the Maryland Road as well.
Exactly.
So it's not that it is impossible, but what the government is doing differently is that they initiated the first phase of the road that started from Ganta to Sakipe, and all the route, when they are being contracted, that will be a complete access to the area. I also talk about the pavement from Grand Bazaar through Greenfield as well. So all the projects, when they are ongoing, I mean, there will be a clear access to the Barclayville corridor. Thank you so much.
First of all, let me thank the callers, especially the people that had good suggestions on what's happening within with the nurses and the other people. So I want to thank those who gave a good suggestion. Furthermore, I don't think it has something to do with me personally that or nurses will be behaving the way they are behaving. I think they are all adults, and we try our best to talk to them and telling them their positions, that they are Red Cross, that they are soldiers, that they should be taking care of patients, or also or we cannot start discussing the penalty right now when we got 4 or 5 days or before they run off. I think and that's a danger. That's even more dangerous at this particular point, to give anybody any penalty now. The idea of a replacement and all those things, those are not things that you can discuss at this particular point or in the situation. So we'll just continue talking to them. We'll be down there again tomorrow talking to the nurses, especially in CB Doma, or looking at the situation and trying to put it at risk as much as possible so that the clients that go to these facilities are safe. And we'll also call into, because we cannot go all the way to River G, but we'll call into each one of these counties, have a county health officer. So we'll communicate where we've been communicating with, especially the areas that we cannot reach. We've been communicating with the county health officers to make sure that they keep their counties in place. And they gave us feedback. We gave them feedback. So the communication had been going on for some time. For the guy who did not understand the abortion law, this is a law that we suggest, number one, that you go back and look it up, because it's clearly defined from 1970 and to what they have written down for the country. We were only trying to make women safer, or by looking at that particular statement within the law. And right now, it's still not the time to be discussing it, since it wasn't passed. We will table it, and then we'll come back and do more community engagement, more education, so that people can clearly understand what the situation is and what we are trying to do in terms of the women.
So I know it's about health. We can talk more inside, but Jallah, I remember you talking this morning that Igbo had launched a very serious investigation at the hospital there to find out those staffs that are involved with doing what they are doing. Like I pitied the second caller that was talking that they are in serious problem where they are not safe anymore. You go there, the entire facility being turned out to somewhere else. I think we gotta continue again, like you said this morning, with the investigation. And because
we'll be there tomorrow, especially on the current incident that just happened. We're not going there to point out anybody. The police should handle the investigation part. So we are going to sit with the healthcare worker that are very politically charged, and we'll go there and stand with them and try to find out what's really going on, especially in that particular facility.
So I'm tempted to ask you this question, because what we're hearing is that Senator Prince Mui is at the center of this. He supports the Unity Party, and he's a big man in the county. If he has control over the health workers at the CB Doma Hospital, when you have the big woman there, saying all sort of things, how do you handle such a thing when you have politicians involved who are at the higher level?
They just had a score incident there where one of the other lawmakers and a group of people
Representative Marvin Cole was there again, because a lot of we heard that a lot of patients got so frustrated they had to go because the doctors are not looking after them. A pregnant woman is there. You should look after her. You say, I'm on call, I'm going to this place, because the person doesn't support your political party. Then the person leaves a pregnant woman and he's running somewhere else. And so that had to, people had to call the lawmaker to get involved. If you have the lawmakers involved with this kind of thing, how can you handle this?
So before the minister comes, let me just lay the basis. And he had this meeting, Senator Moy, before Representative Cole intervened. He called the medical director and all other persons at CB Doma at his place. It was a big gathering, huge one. And after that gathering, what he even did in intensifying was he put money into their pockets, plus he even sent them to different filling stations where those are to get gas in the different vehicles. Wow. It changed that Monday. It was on a weekend. That Monday when they went to work, it changed the entire atmosphere Asibidoma. The heads who were immediately in charge of patients, which of course the minister did not know because she's in Monrovia. We get this information because the press, they're all there. And when they got to work at the beginning of the week, they started to exercise, the lack of regards for these patients right before them. And so what Jallah is actually saying, she's been trying to make engagements. I think that's the reason why she's even going there, because it's getting bad by the day.
It's sad.
And she's here, and she's Jallah alone cannot be the one. Take for example, just like MOE, they got the district education officers and the county education officers. The same thing with like the CHW and other people. So if they're not giving her these real-time information, and she kind of realize these things are happening, the only thing she will do now is, like she said, because if she decides to make a decision now as a government, the next thing is going to be to say we are muscling the health workers.
Yes.
So that's what the problem is.
That would be
so she can't do much.
Where is Dr. Kete? I've been trying to reach him. I can't get him. Is he in country?
I'm asking myself. He's supposed to be in Maryland County.
Yeah, I see pictures of him.
He needs to be more involved because he's the chief medical officer. He needs to be helping.
I've been trying to reach him. I can't get him. But
you should post pictures on Facebook.
If you don't take charge of this, it might escalate to other counties.
It's getting bad.
Sad, but Senator Moyi, if you're involved with this, it's really, really sad because you can politicize the health sector. If our people can, and it's a government hospital. That's where the poor people will go.
In the name of getting votes.
If they go there and then you tell them if they don't support, you're asking them I have to tell you who I support before you treat me.
Yeah.
Like seriously,
that's wickedness.
It's sad.
But just like Jallah said, he made it a scene that the government came to actually cut their money, and that was not the case. He made it seem to these people like the government, the people up there, they don't harmonize your money short. The election are coming here, don't vote for them. In fact, you must express your anger to these people. How can you give a message? And you want to lead the very people. So what happened to the patients? That's what Jallah is saying. Your own people. Are they not your people?
Yeah.
Are they forgiving?
No, because they support. You see, that's the same mentality. And people will say all sort of things. If people died in Dauphin County, the former vice president goes there. He doesn't care. He said, as far as I'm concerned, there is no sedition here. You come to Bone County, you have a senator who is going to influence health workers not to take care of the patients because they don't support his political.
That's what we need to make us another debate tomorrow.
Yes, we'll talk about that.
I already heard your
we'll talk about
comments.
We'll
let's just, end the show.
Let's just wrap up. Daniel, let's wrap up.
So I just want to wrap up on this note, especially the caller that called and tried to point finger at the fact that the minister is not doing well. You see, the issue of government, especially the executive and the legislature, is kind of different. If you have a senator who approves a minister's budget before he or she implements, that senator is going in his county and telling the health workers to go against the government, owing to the fact that the people that are going to that hospital are his people. It tells the treacherous nature of the kind of administration we want to run in this country. So, Madam Health Minister cannot do more than what she's doing, the advocacy she's continuing. All we can say to our people of Bone County listening, this government has always supported you and will continue to support you. At the end of the day, these matters will be laid to rest, and the patient and health workers relationship will become better.
Okay.
That's what I can say, because I think that's the important thing that I can say today.
Politicizing
it's very wrong.
It's very wrong, and I think it's aligning. All of those involved in it must stop, and the people deserve better, and that's what we can do. I hope that we have a flowering conversation tomorrow, and I want to extend a very big thank and appreciation to the both ministers for honoring our invitation. Thank you very much. And Titi, it's up to you.
Dr. Jallah, thank you so much. Minister Coco Collins, thank you so much for sharing our platform tonight. We wish you all the best. Join us, God willing, tomorrow evening when we will be here with another edition of Open Conversation. Don't forget, your support for His Excellency the President can only become a reality if you wake up on Tuesday morning, go to the polls and vote for the president. I hear a lot of you say, we support number two, we support the president, but voting is all about numbers. And so you must get up and go and do it, because you've listened to the health minister, you've listened to the public works minister. There's a lot in store. And so you must keep the engine.
From the east to the west, north to the south, let's come together at home. They say you're not there, we stand, but there we fight. If we not celebrate, we do it for you. While you forget it, you from Lower Country, you from Maryland, while you from Rewa says, I'm a bad way on your trip, I have up on the fine way. Tabila, I love Liberia, oh yeah, yeah. Free land and liberty, Liberia.